welcome to my channel. My name is Jazzy RN. If you're new here, welcome. If you're not new here, welcome back. The goal of my channel is to help nurses pivot from the bedside to remote work. Acentra Health is hiring a clinical supervisor. This job is full-time. I always go straight to the qualifications, and even if you don't meet every single qualification, I still suggest you apply. This job is remote for the US. We work from 8 a.m. to 6 p.m. Eastern Time with rotational weekends, evenings, and holidays as required. You must be an RN in the state of Indiana or a valid compact state license, associate's degree or equivalent experience directly applicable to clinical practice, at least 5 years experience as an RN, 5 years of supervisory experience in healthcare setting with a minimum of 2 years utilization management, 2 years experience applying interqual or MCG clinical criteria in the utilization review process. Now, just a FYI, if you do go to the description box below, you'll see a link that will take you to a website called Cure the Bedside Burnout. If you scroll towards the top of the screen, you'll see navigation links. The one that says resume tips, click on that. A new screen will appear and you'll see where you can go to get interqual or MCG certification. Strong verbal and written communication skills with the ability to convey complex information clearly and professionally. I'm going to skip some of these bullet points. Make sure you do add Microsoft Office Suite to your resume. I would suggest to add it with under a platform bullet point. And just make sure you also include any electronic health records, as well as any software you currently use at your current job and your previous job. So you want to make your resume more tech savvy. Here are the preferred qualifications, and you can read this at your leisure. And the pay is $84,000 to $95,000 per year. The next job is a clinical reviewer. This is for LPNs, LVNs, or RNs. This job is also full-time. This is remote in the US, but you must be clinically licensed for the state of Indiana or have a compact license. You'll work 5 8-hour shifts between 9 a.m. and 6 p.m. Eastern Time with alternating weekends and holidays. They also request you to have a associate's degree in nursing or a practical professional nursing license, diploma or certificate, 2 years of utilization review or management, and our prior authorization experience, 2 years of medical necessity review experience, 1 year of interqual and our minimum care guidelines. I'm going to skip some of these bullet points. Here are the preferred qualifications. You can read at your leisure. And the pay is $28.37 to $39.19 per hour. Twin Healthcare is hiring an RN lead. You must have an active, unencumbered RN license, at least 5 years of direct patient care, nursing experience, including 3 years in a leadership role as either a clinical supervisor, charge nurse, preceptor, or other management area, required BSN from accredited school of nursing. I'm going to skip some of these other bullet points. And the pay for this job is $90,000 to $212,000 per year. Curana Health is hiring a utilization management nurse. This job is full-time. 2 years experience as an RN, LPN, or LVN. At least 1 year managed care or equivalent health plan experience. Experience in health plan utilization management, facility concurrent review discharge planning, and transfer coordination required. I'm going to skip some of these bullet points as well. This one does require you to have interqual or MCG authorization criteria, but this is preferred, not required. I'm going to skip some of these bullet points here. Next job is an RN National After Hours Team Part-Time Compact License. Once again, this job is part-time. This is a part-time job, work-from-home position requiring various shift coverage with a mix of weekends, weeknights, and holiday coverage. You must have 3 years of clinical experience in a hospital, acute care, home health or hospice, direct care or case management position, dedicated space for home office setup, access to high-speed internet service. I'm going to skip the next bullet point. Also, make sure you include Microsoft Office in your resume. Next company is Galileo. The job is a population health RN. You must have 2 years experience in case management and insurance organizations or VBC healthcare startups, or as a primary care RN with population health experience, engaging with Medicare and Medicaid populations with complex chronic conditions. They will require you to have a compact license, active license in the state of New York, Nevada, Michigan, Minnesota, Oregon, California, Massachusetts, Connecticut, and our Illinois is a plus. I'm going to skip these 2 bullet points, or actually these 3, and you must be well versed with operating a Mac, iOS, and Google Suite technology environment. So if you do have Mac experience or Google Suite, make sure you add it to your resume. The pay is $46 to $55 per hour. Highmark Health is hiring a complex case manager. This job is also full-time, working from home in the state of Pennsylvania. They do prefer you to have a bachelor's degree in nursing, but it's not required. 7 years of any combination, clinical, case management, and our disease or condition management experience, provide operations, and our health insurance experience. This is required. Here are the preferred qualifications. And if you have any of these, add it to your resume. It's required to have a state of Pennsylvania RN license or a current multi-state license, or a West Virginia or Delaware or New York license required, and prefer to have a certification in case management. This job does mention a travel requirement of 0 to 25%. If you are fortunate enough to get an interview, I would suggest that you ask about the travel requirement and actually where you'll be going and for how long. And the pay range starts at $72,000 and goes up to $116,000 per year. The next job is a care manager RN. This job is also full-time, working at home, Pennsylvania. A BSN is preferred, not required. They do require 3 years of related progressive clinical experience in the area of specialization and experience in a clinical setting. And they do prefer, if you happen to have these experiences, UM, CM, QA, managed care. UM is utilization management, CM is case management, and QA is quality assurance, I believe. Required Pennsylvania license or current compact license, and additional state licenses may be required depending on where clinical care is being provided. This one also has a 0 to 25% travel requirement. And the pay for this job is $68,000 to $205,000 per year. Elara Caring is hiring an appeals analysis. This job is full-time. You must have home health and hospice experience. A BSN is preferred, not required. At least 3 years experience as an RN in a home health and or hospice clinical care setting is required. Prior functional working experience in medical records review arena, that's utilization review, case management, or knowledge of appropriate billing and coding guidelines is also required. Sentara is hiring an authorization coordinator, licensed practical nurse, remote Virginia. This job is also full-time. You will work from 8 a.m. to 5 p.m. Eastern Standard Time on the weekdays. This is remote from Virginia once more. You must have a compact LPN license, 3 years experience. It's preferred to have either health plan or utilization management experience, and JIVA, J-I-V-A, and Middleman Care Guidelines experience. Now, I have heard of Middleman Care Guidelines. I've never heard of this one, J-I-V-A. Providence is hiring a Utilization Review RN remote. This job is also full-time, and it requires you to work in Oregon. So the position is offered 100% remote work for candidates residing in Oregon. Upon hire, you must have an Oregon RN license, 5 years of clinical nursing experience, and experience working with physicians in collaboration and management of patient care. And preferred qualifications include a BSN, and if you have any experience in utilization review, discharge planning, or managed care experience. And here's the pay: $45.90 to $71.40, or $49.34 to $76.59. Illumifin is hiring a care manager, LTC claims. This is for LSWs or RNs. You must have an RN license or a social worker license, 3 years work experience with older adult population, intermediate level experience with Microsoft Office products, required to uphold the principles of compliance as outlined in the Code of Conduct. I'm going to skip the rest of this bullet point. The annual compensation starts at $60,000 but can increase depending on experience and qualifications. Quantum Health is hiring a pre-cert pharmacy review nurse RN. The position is located in Dublin, Ohio campus, or you may work remotely anywhere in the United States of America. A BSN in nursing or closely related field or equivalent experience is required. Current and active or unrestricted RN license in the state of Ohio, at least 2 years experience, managed care, and our direct care nursing experience required. So not both, it's either or. And ability to obtain additional licenses. Included Health is hiring a pediatric nurse care manager. The job is full-time. You will work weekdays from 9 a.m. to 6 p.m. Pacific Standard Time. They require you to have a BSN. You must have a current CCM certification or eligibility within 6 months of hire, 5 years experience in nursing, 2 years working in care management, must reside in a compact state, active compact RN license in good standing, willing to become and maintain licensure in multiple states. You'll work from 9 a.m. to 6 p.m. Pacific Time. Preference for those based in Mountain and Pacific time zones. I'm going to skip some of these bullet points, but if you do have the ability to speak Spanish, make sure that it's on your resume. And the salary is $73,000 to $103,000 per year plus equity plus benefits. And the last position is a virtual imaging support manager. This job is full-time. BSN in nursing, be an RN in good standing, 5 years of clinical experience, 2 years of direct people management experience in clinical setting. I'm going to skip some of these bullet points, and you can read this at your leisure. The job salary is $94,000 to $122,000 per year plus equity and benefits. And make sure that you focus on these 3 things whenever you are creating your resume: what you did, why it's important, and how it relates to the job that you want.